this is Dr. James at Disc Louisiana with another discussion today. Today we're going to talk about degeneration. Degeneration can occur in the neck, mid-back, or lower back. Ultimately, in the entire body, degeneration happens at levels that we have motion, because things that have motion ultimately wear out over time. The mobility in our necks, mid-back, lower back is ultimately through our disc space. And so our disc space is a large retaining wall, and inside that retaining wall is filled with a bunch of proteins that hold fluid, and the fluid is water, and that performs as a good shock absorber. So when we start losing that water content, the outer wall or the retaining wall that holds all this protein and water, and it's a shock absorber, starts to degenerate and collapse. As it starts collapsing, an easy way to think of it is you can see a ball here, and then we smash it down and you can see it bulging out on the sides. And so that's what happens in our neck, our lower back as well. When you look at the spine from the side, you can see bone, disc, bone, disc. And so these are the discs that as they collapse down, they bulge out. So they bulge out the front, and they also bulge out in the back. When they bulge out towards the back, that's where our nerve roots are. And so that can cause nerve root compression, spinal cord compression. It can lead to arm or leg pain. But the normal overall anatomy of our spines, as far as the curves go, are all from the disc spaces. As we start to lose some of our normal curve because we lose the disc height, the bones start collapsing down on themselves. And so when the bones start collapsing down, our body's natural response is to try to stop this motion. Well, stopping that motion for our body, it stimulates bone growth. And so bone growth, our bones actually get wider, and those are what's commonly referred to as bone spurs or osteophytes. Again, if along with the bulge you have, if it comes out the bone spurs or the osteophytes come out the front, not necessarily a problem. But if those osteophytes start growing backwards into where the spinal canal is, it can start causing nerve root impingement or spinal cord impingement, and that can cause the radicular arm pain, leg pain. Another common question I have is what causes degeneration? And so there's a few major causes. One is normal wear and tear. And so that's ultimately everybody is going to have that at some point in their life. Our joints move, our joints are going to deteriorate over time. Another one's genetics. There's not really anything we can do about that. And so young people that have significant degeneration, sometimes instability in their back, that's usually from genetics. Another cause is trauma. And so if you have trauma to a disc, and it loses some of its integrity, it's going to degenerate at a faster rate compared to a normal disc from normal wear and tear over time. Also, people that have disc herniations, have remote surgeries in the past, if that herniation comes out, that means that disc has been traumatized for all intents and purposes, and so that disc usually degenerates at a much faster rate than a disc level that does not have a disc herniation or any trauma to it. Another one is smoking. Smoking causes loss of the water content, and that losing the water content allows the discs to start collapsing down themselves quicker. And then another one's occupation. Like I said, if you think about these discs in our back as shock absorbers, you can imagine people that are horse jockeys, for instance. They have much worse cervical lumbar spine, as well as truck drivers, because they're constantly bouncing up and down all day. And so even though they may not be symptomatic over a long period of time, ultimately they're getting a lot more wear and tear on their shocks compared to somebody that's not doing a repetitive activity where it's really putting a lot of stress and strain on our discs. And so that's all of our discussion today. If you have any questions regarding degeneration or the causes of degeneration, please put them in the comment section below, and we'll be more than happy to answer your questions. Thank you.